national survey of U.S. workers and employers reveals that many are feeling burned out when it comes to their work. Well, joining us today is finance expert and best-selling author Patrice Washington, who will share some key findings from the 14th annual AFLAC Workforces Report. Thank you so much for waking up with us. I feel like your timing is perfect after the conversation I was just having, girl.
Absolutely. Well, this is really important timing for everyone, Maggie, because it's open enrollment season,
yes,
and understanding your health benefits are going to be so crucial.
So what are some of the highlights from this report, would you say?
Listen, the first thing being topping the list that people are concerned about burnout and financial stress. So the report says that 60% of employees they are feeling the burnout, and the rising cost of healthcare is a major factor. And Maggie, it's not helping at all.
So what does it reveal, would you say, about the role healthcare plays in burnout in all of this?
You know, healthcare is really frustrating. So many people say it's really frustrating not understanding how I would pay for an unexpected medical diagnosis or an emergency medical bill. Here's what the survey reveals. 70% of employees are worried about that every single day. Half say if I got a $1,000 medical bill right now, I would be unable to cover it. And if you are listening and you are a Black or Hispanic worker, it's even more concerning because 3 out of 5 Black or Hispanic workers say if I got hit with a $1,000 emergency medical bill right now, I don't know where the money would come from. So in this open enrollment season, it's not just about choosing the right healthcare plan. This is also about your financial health. So we have to choose wisely.
Now, is there any one area of coverage we should be focusing on or people are worried about?
People are really worried about big diseases being diagnosed like cancer, right? Because it's skewing younger and younger. Younger women are being told to get their mammograms sooner. Colonoscopies are being suggested much younger. And here's the problem, Maggie. Many people don't really understand what the actual cost associated with that is. So 3 in 4 employees surveyed said, you know, if I got hit with a diagnosis like that in the 12 months following, I expect to maybe pay $2,000 in out-of-pocket expenses. But Maggie, the National Cancer Institute says it's actually more like $40,000 or more that you would have to be able to manage after such a diagnosis.
So how can employers help when it comes to burnout?
Okay, employers really can be more connected to the pulse of their employees. So just because they have healthcare benefits, they have to talk about it. It's not enough to only talk about it during open enrollment season. So I suggest that employers make a surround sound 12-month campaign to make sure that their employees know what's available to them. The other thing that employers can do is push for people to take their PTO. I always say at Redefining Wealth, listen, the number one place that we need to focus on when we're trying to build financial wellness is being mentally and physically well. So encouraging your employees to be well, to take their PTO, to have work-life balance is going to be so key for employers to do.
You're an amazing advocate for us. I already feel better just hearing from you. Where can we go for more information, my friend?
Well, for more information about how you can bridge this gap and get supplemental coverage, not just your traditional health care, but adding in something like AFLAC to give you more peace of mind, learn more at aflac.com/AWR. This is open enrollment season. Do your research, know what's available to you, and supplement where your traditional health care insurance is kind of leaving you open.
I really appreciate you taking the time to speak with us. Thank you so much.